Welcome to The Handoff, the podcast for nurse leaders from Trusted Health. I'm Dr. Danny Bowie. I'm thrilled to share my conversation with Dr. Brian Sisk. Brian is the Senior Vice President and Chief Nursing Executive at Memorial Hermann Health System. And he shares his insights on embracing innovation and driving change in the healthcare industry. We'll dive into the exciting work that's happening at Memorial Hermann Nursing Institute, exploring their community-centric approach, and discuss the crucial roles nurses play as problem solvers and innovators in healthcare today. Brian, welcome to The Handoff.
Well, thank you so much. I'm incredibly happy about the opportunity to spend an hour or so with you today.
Brian, I want to jump into it and just start helping our listeners understand a bit more about who you are and your professional journey. So if you could tell our listeners a little bit more about your professional background and journey and how you got to where you are today.
I look back and I'm so fortunate to have worked in, all models of healthcare just about with some really amazing people. Started my nursing career in the military as a computer programmer, transitioned into nursing, best decision ever for me because I absolutely love being a nurse. Retired after a 20-year short stint in the military. Had a lot of amazing opportunities in that system. I wouldn't have traded that for anything. And that in that period of my life, I really discovered something about myself that I don't know that I fully appreciated until kind of now. And I'm incredibly mission driven. So I transitioned from the Army into the VA health system as in their ambulatory footprint, ACNO, CNO, was in that system a total of about 10 years. Then moved to an incredible opportunity with HCA, was with them in the for-profit world, both at their corporate office and at their system level for about 4 years. And then how could you not take an opportunity when Memorial Hermann established this role? I saw that as just, that really is the opportunity kind of been looking for my whole life, to be honest with you, and was fortunate enough to be here. And I've been here for about a year.
Wow. The stars aligning, and I am so intrigued by your background, computer science through military, and then for-profit, not-for-profit. It's quite diverse and unique and probably gives you some really important perspective, I think, for healthcare in general. And I just love hearing your mission-driven approach. Now, considering your diverse background, both non-nursing, military, private, all these different sectors that you mentioned, as you think about your journey, are there any unique programs or nursing initiatives that you found to be particularly impactful or interesting as you went throughout your career?
Yeah, there's so many. In thinking about that, I'll dive into one that really developed over a period of years. Started with my military background, because where I ended my military background is I had the opportunity to really work alongside and build capabilities and drive outcomes with nurses from all over the world, not just with the U.S. Army, but with our allied nations, looking at how they develop strategies based on populations, how we intervened in health systems, and again, doing that all over the world, really opened my eyes to the capabilities of what nurses can be as true professionals and being partners in some of these incredibly complex situations. And, it didn't matter the environment they're working in, incredibly austere environments, as you can imagine, all the way to these tertiary, quaternary, really complex urban type environments. And so looking at the world from really a different lens of a nursing perspective, had the capability to say, hey, as nurses, we have the opportunity to change lives, not only just at the individual at the bedside, but we can impact entire communities. So when I transitioned into the VA, had the opportunity to find a couple of people that really believed in the vision of, dealing with populations and making an impact on a bigger scale. We started a small 2-person population health nurse-led clinic, if you will. The outcomes were amazing. And over a period of years, that really blossomed into a multidisciplinary integrated case management process. Don't want to try to take credit for what the VA's integrated care management program has become, but I do like to think that our efforts from that time where we started with a 2-person shop to, over 50, that the outcomes were so amazing that we helped spark innovation, spread modernization throughout the whole VA system. And really proud of two of those leaders that were part of that original model, Dorothy and Rachel. They have continued to lead those efforts all over the country. And so, really buying into that, something that we can start small, produce the outcomes, is a really good example of what nurses bring to the table. Dorothy being the nurse, Rachel's actually a social worker who's actually a big part of building that multidisciplinary team on how we work together, deliver outcomes that not only just improve what we're doing at a health system level, but ultimately really can impact populations, not just for your community, but all over the country.
That's amazing. And I did not know that you had such a global view of nursing. And I'd be so interested to just have a conversation for an hour about what you learned, around the world and the nursing profession in different cultures and countries. The integrated model that you developed, as I was listening to that, I loved hearing how you started small and then built and refined the process and allowed for that innovation with, it sounded like true PDCA. And obviously, I also heard the alignment of mission-driven and community health. I want to focus a bit more also on the work that you're doing presently. I know that, as you mentioned in your intro, as the system CNO for Memorial Hermann, that was the role that you have been looking for throughout your career, and it's a perfect fit for you. And can you share a bit more about the nursing vision and core principles that you're living by and leading through at Memorial Hermann?
Yeah, absolutely. This is, at Memorial Hermann, I had to brag on the system just a little bit. We're a community-owned healthcare entity. We're the largest provider of healthcare in our region. So we feel like we have a true duty to our community and to operate in a way that actually builds healthier communities now and for generations to come. And so a little bit about our health system. We have around 12,000 nurses. And the dedication to excellence is amazing. And we have multiple Beacon Awards, Lantern Awards, our Salute to Nurses, which is a thing the Houston Chronicle does that really highlights nursing excellence in our communities. We have over 70 nurses that were recognized this year out of 200, 5 in the top 15. And then at the same time, incredibly proud to say we have 8 magnet designated facilities. If you just take a look at that, soon to be 9, we have number 9 right in the crosshairs that we're chasing down as we speak. But if you just take a look at that, there is a reason where you see, some of the Joint Commission accreditations, the U.S. News reports and things. There's a reason that our system consistently shows up in multiple. And I think that it has a lot to do with we as a system are committed to excellence. But I'm more proud to say that as nursing, we're committed to that. And I think it's incredibly important that we leverage that. And so what we've done here is really work hard to elevate the voice of nursing. And as we have gone around through our surveys, direct conversations with different nurse leaders and frontline nurses, rounding all the things we've done to really make sure that we're taking a shot at giving every voice an opportunity to be heard and then really acting on that. So we've really come up with 3 things that have been pervasive. It is grow, excel, and reimagine. So we have bucketed our nursing strategy based on the input from the nurses in those 3 buckets. When we talk about grow, we're talking about optimizing clinical education efforts, advancing opportunities, different talent strategies, and then how we align with our academic partners to make sure that true career progression is available at all levels. In our Excel space, we're talking about our professional practice, and that's where you see a lot of the outcomes of that, where the excelling in the magnet designations. We have a transition to practice program that is accredited with accolades through the ANCC, and a lot of the other industry recognitions. And then our advocacy platform, we took 80 nurses to the Capitol just a few weeks ago to advocate for the workplace violence bills and for tuition reimbursement. Those bills are moving nicely through the process at this moment. I'd like to think that the voice of our nurses had something to do with not only impacting our community, but Texas in general. And then, in our reimagine space, really taking a look at, we've heard loud and clear, we need to reimagine acute care and in particular med surg. And what type of innovation and inquiry can we bring to that environment where we're looking at safety and well-being and building our nursing brand in that space where you could be a med surg nurse and have all of the things that we can offer and deliver excellent care, be a part of the team, and do that maybe in a dual role, like with an academic partner or a professional practice partner, or maybe with a robot. And it's really kind of looking at all of those types of things and delivering them to the bedside nurse, but delivering the things that they find valuable. And I think that's what's incredibly important as we talk about all of this strategy. It really is about elevating the voice of the nurse, what is valuable in that space, and then how can we wrap services around that to make sure that we have the best potential for those things to come to fruition.
As I listen to this, you're talking a lot about elevating the voice of the nurse, and I was just really impressed by the example of taking 80 nurses to do advocacy work, both in the sense of safety and other initiatives at hand. And what a beautiful example of magnifying the nurse's voice at a national level to impact specifically what's important to their profession. In my career, I've helped some health systems develop some strategic plans, and I really like how you've created those 3 categories. Do you have any insights into, as you develop this plan with, these pillars, and then you build programs into it, are you setting this up at a 2 to 5 year mark? Is there specific KPIs or ways that you're trying to continue to show success and improvement with your strategic plan associated with these 3 core principles?
Yeah, so I'll talk about one in particular because I really think that in healthcare in general, when you take a look at entry into healthcare as a profession, we know that we have lots of vacancies all over, right? And we're not seeing just a flood of entrants into these application pools. And so some of that is, some of the press that has been with COVID over the last few years. The other is, as we talk to some of the high schoolers who have no exposure to a healthcare environment, they look at that building and say, hey, that's a big building. How do I go apply? I don't even know what jobs are in that building, right? And so as we look at our strategy, there are things we've got to look at all levels. Number one, how do we take a look at the pipeline coming into healthcare? How do we support that? And we hear a lot about working with high schoolers and giving them exposures and things like that. We think it's much bigger than that because I still think there is a barrier of an 18-year-old coming out of high school and walking into an acute care environment and having the tools they need to be successful. So I think we got to look at that differently, right? We got to look at, how do we build units that would support that type of growth where somebody can start in that environment? Or do we have the opportunity to really start them? Most of our prep high schools are really geared for somebody to go to college, but can we create an opportunity that is more about, well, I don't necessarily want to go to college now, but how do I get into healthcare, see what it is I want to do, but be on a pathway where I can go to college, and then ultimately we would pay the tuition. And so that really requires us to think differently with our academic partners. And we have some amazing things underway that happy to come back some other time and talk about what the outcomes of those are. But it really is, if I have an amazing patient care technician on one of my units, comes to work every day, smiles, patients love them, but to go to nursing school, it's 4 days a week. And if they've got to work 3 days a week to put food on the table for their families, the math doesn't work in a favorable way for that. And so we've got to look differently about how we partner with our academic partners to open up these opportunities. We are actively involved in that. And then at the same time is, as an LVN, how do I then do the same thing to get my RN? And then as a individual, as an RN with an associate's degree, and I want to get my bachelor's degree, how do we open up those doors? And so I think a lot of work we're doing right now is aligning those partnerships. We're doing no-cost tuition reimbursement. a lot of those things to make sure we're modifying our job descriptions. We're doing a lot of things in those areas based on direct feedback from our front line, again, at all levels. And then taking that, then really taking a look at how can we as a system align our jobs and our duties differently, and then how do we bring in our academic partners with some very clear expectations of this is what we really need to have in place for the individuals who work in the system to be successful.
That is a differing approach that I haven't really heard in that. I have heard of programs around, introduction of high school students to healthcare. But what I like hearing is how to make that a good experience and a successful experience, because I would agree the tool sets you need and the skills you need to be able to enter into the complex space of healthcare, usually you're not adequately equipped as you're graduating high school. And even as a new nurse, I know when I started, it was quite overwhelming. And so I think the approach that you're taking of looking at this holistically for success and sustainability of your workforce is something that I would to love learn more about as you continue to grow those programs and show how you're helping the workforce move through. Building the pipeline is key. I am intrigued to know also kind of your retention metrics. I mean, you touch on this a bit about bringing the workforce in and helping them grow through their career. I heard career progression from LPN to RN. I also heard a little bit about flexibility, which we'll talk on in just a second. Scheduling, how do you align scheduling to match this personal growth and professional growth? But any retention strategies at play to continue to also retain the workforce that you are working really hard to recruit and design?
Yeah, so here I'd had to really take an opportunity to brag on our transition to practice program. In that program, there's several of these in the market, right? But we're really proud of ours. Number one, that we are accredited through the ANCC, which is a pretty rigorous process. But as we have brought individuals in, again, doing the initial upfront work, having discussions, really aligning their onboarding to what their needs are. What we've seen as a system is we have upwards of 80% retention in that cohort, which is something for us to be really proud of. Honestly, I hadn't seen numbers like that before. So it's that is working. And so how do we take that same type of approach into a patient care technician, into an LVN? Those are all things that we're actively exploring, because I do think, in healthcare, we're hiring more people than we ever have, just in general. But at the same time, our retention, if we don't get that under control, it's equally as important as bringing talent in. In fact, I would say it's more important. So putting a lot of energy into how do we retain career growth, and then wrapping services around individuals so they want to stay with your health system.
Yeah, which I'm guessing that's under kind of your Excel opportunity as well, and your grow and then Excel. I want to also speak to the reimagine, and we've talked a little bit about this. You touched on it. I'm doing this podcast to talk to leaders around flexibility, what it means to the workforce that you're leading, what it means to you as a leader, and it really then lends itself into what is the future of nursing? But Brian, from your perspective as a nurse and a nurse leader, what do you think flexibility means to the nurses that you're leading, and to you and the leaders that are in charge of serving those nurses?
Yeah, one of the things that I have to say is when we talk about flexibility, we tend in the industry to get locked right in the schedule. Right. And I think it's much bigger than that. And, we've got some wonderful HR partners and our system leaders. As we're looking at this, we think it's much bigger than that. It's about, the skills of lifestyle management, your physical health, your nutrition, financing skills, your community, your social well-being, your career mobility, emotional health. It's all of those things. It's about where you are in life. And then how do we bring things to you? Again, scheduling, incredibly important. Certainly don't want to underestimate how important that is, because that does allow you to kind of align your life. But there's all these other stressors that, as we have an incredibly mobile workforce now, how do we wrap these things around you in a way that you can get to them, right? So it's not that you have to come to a clinic, but how do you have access through things like apps and, 24-hour hotlines and things like that. So you have access to them when you need them versus the traditional model that, I think we've all worked with over the years where the clinic is open from 8 to 4. And if you need something, give us a call during that window. So what we have noticed is when we talk about flexibility, it's much bigger than that. And so again, getting this information came directly from our workforce. So we didn't make this up. This is something that we have spent a lot of energy collecting the voice and then reacting to that and really kind of delivering on things that matter.
Yeah. How did you get the voice of the nurse? Was it through surveys? Was it listening tours? I'm sure our leaders and listeners would love to know kind of what your strategy was, because this is a theme I'm hearing through this conversation, is community focused, but also the voice of the nurse that's informing your strategic plan, priorities, and the way that you're serving as a leader. So what did you do to help get the voice of the nurse to, the executive table as you think about these strategic plans and building out programs?
So it gets back to, you mentioned a few of them. We do a lot of surveys, right, in different facets. But what I really want to talk more about from the nursing side is our professional practice and our shared governance, because I think that is just a wealth of information. So you have individuals at the front line who are really leading the charge on how we deliver on nursing practice. And under the magnet principles, it's not just about nursing, it's about workplace and everybody being bought into, we're going to deliver excellence, and this is our bar. And so you get that bar from talking to your front line, and by creating this really robust shared governance committee, we're able to really glean a lot of information from them. So when we take a look at, we've initiated like a military style challenge coins for those who impact our system through some of the practice and innovation work they've done. So as we develop that recognition program, old school method, we would have just kind of put that into practice and moved on. But the way we prefer to do that is to give them those things and say, hey, how do you think this would be the most meaningful way to do this type of experience? What would be the best way to do that? And we let them develop it. And then when they bring that forward, then we work as a system to make sure that we can execute on that and take that forward. So that's really what I think is one of our strengths. With having so many magnet designated facilities, I think that is just an outcome of the amazing work that our governance committees are doing.
Yeah, I was going to say, I'm not surprised that you are moving towards, a 9th hospital getting magnet designated, as I heard your strong shared practice council and governance, which is a key foundation for magnet. So that's really exciting. And I think something that is a model that, creates sustainable change. And it's meshing both the full spectrum of who needs to be involved in these types of changes, which is definitely the frontline leader. They are the boots on the ground and carrying it out. And so hearing that a lot of the solutions come from those that are doing the work, and then your leadership team and executives, giving the resources and clearing the path to make this reality is just a phenomenal model. What are your thoughts about the future of nursing? And as you talked about Reimagine as one of your core principles for Memorial Hermann, a strategic vision for nursing, you mentioned just briefly a little bit about the med-surg space, a little bit of emergence of dual roles. And can you elaborate a bit more on your thoughts on that and what you were implying when you talked a bit about the med-surg space and these dual roles?
Yeah, so I think I need to back up just a little bit, because to be a leader in this space, we have to have individuals who are committed to a vision like this, right? And I have to say, none of this happens without our amazing leadership at our facility level. And I would be remiss if I did not call out our chief nursing officers, because I do think we have the best in the industry, bar none. And they have really bought into, if we're going to do things differently, being an innovator isn't always the easy space to live in. So we realize if we're going to be an innovator, we're going to have to think about things differently and stretch differently. And then how do we rely on each other across the market to make sure that as we align in this space, the things we're doing replicate, right? And so one of the things that we have done in that space is we think about what the future of nursing is, and especially in the med-surg space, is one of the things they put on the table early on is we need a nursing institute. And so what we have done is, I'm very proud to say that we have launched our Nursing Institute officially as of January. Now, we'll have the messaging, like the big bang will go out around Nurses Week, because I think it's just an amazing story. But under our Nursing Institute, what we're looking at is how do we elevate the nursing profession, everything from excellence to well-being, and be the national leader. How do we accelerate that innovation to the bedside? So we have amazing nurse leaders in our facility. How do we wrap the services around them so they can move fast, right? But purposeful at the same time, because what we learned in COVID, I'm a big fan of, I believe innovation fatigue is real. We had a lot of things thrown at the bedside during COVID. And I think that, we want to make sure that we're avoiding that, here's the one more thing, and it's going to create work for me, right? But that's because the model was backwards. If we take a look at what the bedside nurse and our nurse leaders at the facility are looking for, and then we answer that question, it is not one more thing. This is something I can get behind. And if it works, awesome. If it doesn't, dude, we tried. And so I think that's the difference in messaging, because we really leverage that workforce differently. And then that helps us to excel in our outcomes and our operations and everything that we're doing. And so as we take a look at how do we reimagine med-surg, a lot of the ideas that we've heard that have been put on the table are, I really like med-surg, but it's a hard environment to work. And so how do we answer the question of, maybe I can work one day as a faculty member for one of our academic partners, and then 2 days on that same unit as a staff member. And you think about the incredible continuity we would have, because what we tend to see with, multiple schools rotating through our different environments is none of the hospitals in the market do things the same. And so individuals are constantly bombarded with how we do business versus somebody else in the market. And so you just take a look at how can we create continuity and open up opportunities and extend somebody's career in med-surg. These are some of the things that we're really taking a look at, is how do we create these dual type roles where we can do some of these things, because we think it would be great for students, and it would also be great for our facility as we create that pipeline that truly gets to know us as a system, and at the same time, really buys into our culture about how we deliver that type of care at the highest level to everybody who walks in the door.
That approach, I think, is going to be really important in the days ahead, specifically, as we look at the workforce that may potentially retire. And is there a way, we know the advisory board, there's the potential knowledge gap that comes with retiring workforce. And so extension of the career and that knowledge, institutional knowledge, but also practice knowledge, that's so important for our health systems, and coming up with unique ways of engaging, such as dual roles like faculty or med-surg. I've worked with some other health systems that have been like mentor and preceptor, and then one day med-surg. So I think being able to create that diversity of experience for those that are looking to continue to practice, but maybe just not in the extensive way that was of the past, is going to be really powerful. The Nursing Institute, you briefly mentioned that, but what exactly is the Nursing Institute? What does that encompass? You mentioned that's going to be launched during the Nurses Week, which is coming up soon, the impactful work of your CNOs at every hospital and leaders at the front line. But I'm just curious if you can share a little bit more about what the Nursing Institute at Memorial Hermann is.
Yeah, so the way we look at the Nursing Institute is, it really is an accelerator, right? So we have so many things that are coming down the pipe. Healthcare is evolving at a pace that stressful and energizing all at the same time, right?
Yeah.
It's like, but we take a look at the nursing innovation. Really, the current model is based on, a leader kind of wrapping their arms around a PI project, or if you're going to the evidence-based practice route, really like struggling with the question, kind of gathering the resources around it, executing it, and then getting those outcomes really kind of all lands in their lap on how we get those outcomes and then scale them across the system. The way we're taking a look at the Nursing Institute is how do we bring these wraparound services to that individual who's interested in innovation and really, give them the playbook on, hey, let's measure things this way. And can we actually do that measurement for you versus you spending your time there because you're delivering direct patient care? That's what we want you to do. We want you to do that at a high level. But at the same time, we want to help you get through some of this innovation because we know that's important to you. It's important to us, certainly, too, right? And so how do we wrap these services around? It may be a less intense PDCA type exercise, or it may be all the way to some of the things we're looking at that would be true nursing research. And so we actually have some nurse scientists aligned up under our Nursing Institute to help with things like designing research, and then how do we execute on that and making sure that we stay aligned with the research question. So it really provides the whole gamut of services. And as we look at technology, even the list on looking at technology, by the time you get through vendors and the security and all the things that it takes to make that happen, really want to take that as much off the facilities as we can, because we think that actually puts us in a much better spot to be innovative than if we kind of follow the traditional way of handling some of those things that we've done in the industry for 100 years, right?
Yeah, where you can accelerate, please do. We know that it takes 17 years on average to get, new evidence into practice. By that point, it's not new anymore, but practice transformation is a bit of a lift. And so the Nursing Institute sounds like something that can help bring innovation and accelerate that. One last question. You talk a lot about wraparound services. And so would that be the support of those that you have in the Nursing Institute, like nursing scientists or others, to help kind of guide those that are a part of it around, the process, whether it is a PDCA cycle or true nursing research or leading a project? Is that how you would define kind of those wraparound services? Because I've heard you mention that a lot, and it's kind of a new thing I'm hearing. Yeah.
Yeah, absolutely. And this is what we're growing into. It's new, but this is exactly what we're growing into is what we're asking right now is we have brought in a couple of nurse scientists to actually help with some of these early initiatives that we've already identified. But it really is, what type of service do you need? Is it a data need? And so we have an individual in the Nursing Institute who is aligned with delivering some of that data. We have a nurse scientist in the Nursing Institute who's helping with, the questions, and, not everybody knows how to write scientifically if you're, and so bringing some of those expertise to the table so that we can help with that.
I wish I had some wraparound services sometimes. That would have been really helpful in my career. A lot of trial by fire in some of the learnings. And so your ability to help support the nurses at Memorial Hermann with these types of support structures is phenomenal. I know Memorial Hermann is a very community-centric organization. You're committed to serving your local communities. Can you share a bit more about unique programs or initiatives that you have in place to help accomplish this mission-driven purpose that Memorial Hermann has?
Yeah, I'm so proud to be in a system. We, in our community contribution are running around $470 million. And that does so much in our communities. We have, about a dozen or so free clinics in the market. That include some of our school-based health clinics, a lot of initiatives around exercise and recreation. We're doing a lot with the restoration of parks. And at the same time is, taking a look at, how do we align differently? And I talked about our real drive to look at making education more accessible. But it just is amazing to sit back and take a look at all the opportunities we have as a system our size to take a look at a system that's our size and the impact that we have. You take a look at our Southwest Hospital, we have committed to being an anchor institution. And what that means is we are going to hire from the community that surrounds our hospital. We're going to be dedicated to making that possible. So that's where we've done a lot of the energy we talked about earlier, as far as looking at our job descriptions, removing barriers to entry as a healthcare. And what that really does for us is we'll have to have the services to make those things, successful. So it really is full circle, because then the individual who is coming from the community is part of the healthcare team and is making our community healthier, and at the same time delivering excellence at the bedside.
That is really an impactful model. And, the community approach, you're really holistic in how you're looking at health, which we know it's not just the entry point to a hospital or even a doctor's visit. It's friends, family, lifestyle, professional opportunities, academic, spiritual, all these components that make us human, and being able to impact in different ways before someone enters into the acute facility or a doctor's office is really a forward-thinking mindset. And I can see now why you said the stars align with joining Memorial Hermann and your background in some of the work that you had done with population health prior and leading in that space. Brian, this has been really insightful and I think inspiring as I listen to the mission-driven approach that you and your leaders at Memorial Hermann are taking. As a final question, I would just love to know, what would you like to hand off to our listeners today?
Yeah, so, we talked a lot about healthcare evolving, and I think that, we really need to embrace that and lean into the opportunity that is being presented every day as far as innovation goes. This space is wide open for nurses, and to be leaders in this space, there's a reason that we are consistently rated as the top trusted profession. I think it's time to add innovation to that. So it really should be nurses, trusted, innovators, all rolled into one. And I think the opportunity is sitting right here in our lap. We just got to own it.
I love it. Yes, I would agree. Innovators, problem solvers, and it's what we do every day when we care for patients or communities. And the time is now. And it sounds like you and your team is leading the charge in this space. I would love to check back in a year or so and hear how everything's going. Really appreciate your time today, Brian. And thank you and your leaders at Memorial Hermann for how you're serving your communities with health, but also with new ways of operating to sustain and change healthcare.
Oh, thank you for letting me spend some time with you today. It's been a pleasure. It's been a pleasure.